Did you know that the way you lie in bed each night could be the primary reason you wake up with back discomfort, shoulder numbness, and feeling like you haven't slept at all? And here's what's worse. 8 out of 10 people over 50 are sleeping in the wrong position without even realizing it. I've witnessed this thousands of times throughout my career. I'm sleep physician Dr. Emily Carter, and with over 10,000 patients I've examined, treated, and counseled, I can tell you one thing for certain. Most of the discomfort you think is just getting older actually comes from incorrect sleeping positions. In today's video, I'm going to show you exactly the 2 best sleeping positions backed by science that help eliminate aches and improve your sleep quality starting tonight. But more importantly, I'm going to reveal a serious mistake that most seniors are making, and it's quietly destroying your sleep every single night. If you're serious about sleeping better and waking up without discomfort, hit that subscribe button right now so you don't miss other sleep improvement tips from me. Before I show you the 2 best positions, you need to understand why sleeping position can completely transform your quality of life. Here's what happens to your body after 50. Your joints become less flexible, the discs in your spine lose their elasticity, and your muscles naturally weaken. This isn't something to feel discouraged about. It's just the reality of aging. But here's the crucial part. These changes mean your body needs more support during sleep, not less. A 2018 study from Johns Hopkins revealed something eye-opening. 73% of people over 55 experiencing ongoing discomfort could trace it directly back to incorrect sleeping positions. Think about that for a moment. 3 out of 4 people are experiencing unnecessary discomfort simply because of how they're lying down each night. So, what's the golden rule? It's called spinal alignment. Keeping your spine in a neutral, straight line from your neck all the way down to your lower back. When your spine is properly aligned, pressure is distributed evenly across your body. Your muscles can truly rest and recover, and you wake up feeling refreshed instead of stiff. Now, finding the right position for you depends on 4 key factors: your personal comfort preference, how well you breathe at night, any current aches or discomfort you're dealing with, and other health concerns like sleep apnea or acid reflux. When you understand this principle, you'll know how to adjust things for your own body. You won't just be following instructions robotically. All right, now let's dive into the first position, the one that's worked wonders for thousands of my patients. Left side sleeping position. This position doesn't just help you sleep better, it can actually protect your brain from cognitive decline. Let me explain why sleeping on your left side specifically makes such a difference. When you lie on your left side, you take pressure off your vena cava. That's the largest vein in your body that carries blood from your lower body back to your heart. This helps your heart pump blood 20 to 30% more efficiently and prevents blood from pooling, which causes those uncomfortable varicose vein symptoms many of us deal with as we age. But the benefits go far beyond circulation. This position keeps your airways open and unobstructed, which can reduce snoring by 40 to 60% and even help with mild sleep apnea. If you struggle with heartburn or acid reflux, left side sleeping is a game changer because it keeps your stomach and gastric juices lower than your esophagus. Now here's the truly remarkable part. And this is based on breakthrough research from the Journal of Neuroscience in 2015. When people over 50 sleep on their side, their brain's glymphatic system, think of it as your brain's waste removal system, works 25% more effectively. This system clears out toxic proteins linked to Alzheimer's disease while you sleep. Let me share a real example. I had a patient, Margaret, 67 years old, a retired teacher who came to me because she was waking up 3 to 4 times every night with heartburn. After just 2 weeks of switching to left-side sleeping, her symptoms decreased by 70%. She told me, "I can't believe just changing how I lie down made this much difference." But here's the warning. If you do this position incorrectly, you can actually make neck, shoulder, hip, and lower back discomfort worse. So let me walk you through exactly how to do this right. Step 1. Choose the right pillow height. Have someone take a photo of you lying on your side from the front. Your neck and spine should form a perfectly straight line. If your neck curves upward or droops downward, your pillow isn't right. Step 2. Place a pillow between your knees. This is crucial. When your knees touch, it puts tremendous pressure on your hip joint, which creates tension in your lower back. The pillow needs to be thick enough to keep your top leg and bottom leg parallel to each other. Step 3. Position your arms correctly. Hug a long body pillow in front of you. Never put your arm under your pillow. That cuts off circulation and causes numbness. Here's the key takeaway. The right pillow keeps your neck aligned with your spine. Don't hesitate to experiment with different pillows, or even roll up a towel to adjust the height until you find that perfect balance for your body. Now, if side sleeping isn't comfortable for you, the good news is the next position is actually my #1 recommendation. Back sleeping position. This is the position that 9 out of 10 orthopedic physicians recommend, but 95% of people do it wrong without realizing it. Let me tell you why this is considered the gold standard. When you sleep on your back correctly, your body weight is distributed most evenly across your entire skeletal frame. There are no excessive pressure points like you get with side sleeping. Your muscles receive natural support, and your neck experiences the least amount of strain compared to any other position. According to a 2020 report from the American Academy of Orthopedic Surgeons, proper back sleeping reduces pressure on the L4-L5 disc, that's the most common location for lower back discomfort, by 60%. That's a significant reduction. Now, I need to be honest about the drawbacks. Back sleeping can increase snoring and sleep apnea because gravity pulls your tongue backward. It can also worsen acid reflux for some people, and if you're already dealing with severe back discomfort, this position might feel uncomfortable initially. Let me share Robert's story. He's 72, a retired engineer who came to see me after 15 years of ongoing lower back discomfort. He was taking over-the-counter relief medication every single day. After just 3 weeks of adjusting his back sleeping position correctly, his discomfort decreased by 80%, and he was able to stop the medication completely. So here's exactly how to do this right. Step 1. Choose your neck pillow carefully. You need a lower pillow than you'd use for side sleeping. Check this way. Your chin shouldn't be tucked down toward your chest, and it shouldn't be tilted up toward the ceiling either. Your neck should be in a natural, neutral position. A contoured pillow with a depression in the middle works beautifully for this. Step 2. And this is the most important step. Place a pillow under your knees. Let me explain the mechanics here. When you lie on your back, your hips automatically tilt forward in what we call an anterior pelvic tilt. This creates a gap between your lower back and the mattress, which strains your hip flexor muscles and lower back. When you elevate your knees with a pillow, you unlock those hip flexors and allow your lower back to settle closer to the mattress. You're not trying to flatten the natural curve of your spine completely, you're just reducing the curve enough to relieve that strain. You can use a regular pillow, a rolled blanket, or anything that creates the right elevation for you. Step 3. Keep your arms either relaxed at your sides or resting gently on your abdomen. Avoid placing them high on your chest because that creates shoulder tension. Now, here's a special solution for older adults. Elevating the head of your bed 30 to 45 degrees provides 2 major benefits. First, it reduces snoring by 50 to 70% because gravity helps keep your airway open. Second, and this is huge for seniors, it makes getting out of bed so much easier. Instead of having to sit up from a flat position, you simply swing your legs down and you're already halfway to standing. You can create this elevation with a wedge-shaped pillow under your mattress, or even stack 2 to 3 regular pillows. Some people place blocks under the bed legs at the head of the bed to create that slope. If you're trying one of these 2 positions, comment below after 3 days and let me know what difference you're noticing. Here's the practical tip. Before investing in any new equipment, experiment with what you already have at home. Stack pillows, roll towels, prop up your bed legs to see if elevating actually works for you. Every body is different, and what matters most is finding what works for your unique situation. Great. Now you know the two golden positions. But here's the critically important part. I need to warn you about an extremely common mistake that might be happening to you right now. If I caught you sleeping in this position, I would wake you up immediately, no matter how deeply you were sleeping. That's how serious this mistake is. The dangerous position I'm talking about is falling asleep on your sofa or in your recliner, with your head either dropped forward or tilted all the way back. Here's why this is a silent destroyer of your spine. When your head is in either of those positions, it creates extreme strain on your neck muscles. We're talking about 50 to 60 pounds of pressure, equivalent to the weight of a small child pressing down on your neck. This unbalanced pressure on your cervical discs in the C5, C6, and C7 vertebrae restricts blood circulation to your brain, especially when your head is tilted back, and it essentially doubles that text neck curve you get from looking down at your phone. According to Sleep Medicine Reviews in 2019, when your neck is angled more than 30 degrees for longer than 2 hours continuously, you triple your risk of accelerated cervical disc degeneration. But here's the deeper psychological reason why so many older adults do this, and this is important. They do it because it's easier to breathe. Your body is actually trying to self-treat sleep apnea. When you sit upright, gravity pulls your tongue forward and out of your airway. But you're trading temporary, easier breathing for long-term destruction of your neck and back. Let me tell you about Linda. She's 69, a retired nurse who came to my clinic with ongoing neck discomfort, hand numbness, and frequent headaches. When I dug into her history, I discovered she'd been sleeping in her recliner for 2 to 3 hours every night for 5 years. Her reason? I breathe easier when I sit up. We diagnosed moderate sleep apnea plus cervical disc degeneration. After treating her sleep apnea and changing her sleeping position, her neck discomfort disappeared by 90% in just 6 weeks. Here are the warning signs. You might have sleep apnea. You feel like you need to sit upright to sleep. You wake up with morning headaches. You feel exhausted all day despite sleeping enough hours. Or your family members tell you that you snore loudly or stop breathing during sleep. Here's my life-saving advice. If you can only sleep when sitting upright, that is a serious warning sign. Over 80% of people with sleep apnea go undiagnosed, and this condition doesn't just make you tired, it significantly increases your risk of experiencing cardiovascular concerns and cognitive decline. Don't ignore what your body is trying to tell you. All right, now you know what to do and what to absolutely avoid. Let's wrap this up so you can start applying this tonight. We've just gone through an important journey together. Remember, left side sleeping protects your heart and brain, back sleeping relieves your spine, proper pillow adjustment is key. Keep your neck aligned, support your knees, and absolutely avoid sleeping in chairs. But I know what you're thinking. What if I do all this and still can't fall asleep? That's exactly why I'm releasing my next video. I'll reveal powerful, natural, medication-free methods that have helped over 2,000 of my patients fall asleep in just 10 minutes, even those who struggled for years. These methods are based on neuroscience and proven through real clinical cases. Don't miss it. Subscribe and turn on notifications now. If this video helped you, hit that like button to help others find it. Comment below. What position are you sleeping in? What's your biggest sleep struggle? I read every comment and will respond directly. If you know someone struggling with sleep, share this video with them. It's the most valuable health gift you can give. I'm Dr. Emily Carter. Here's to a good night's sleep, starting tonight.